Hi there, my name is Dr. Steven Shoshany. I'm a chiropractor and I practice in Manhattan. I've been practicing in Manhattan since 1999 and got into spinal decompression right around 1995 when it was getting popular. So I've been utilizing spinal decompression in my practice as a modality for about 11 years now. So being a chiropractor, we deal with patients with bad necks and bad backs amongst other things. The way I got into spinal decompression was personally my dad, who's a laborer, works really hard and hurt his back to where chiropractic wasn't helping anymore. And he went to a chiropractor that utilized spinal decompression and it saved his back. It worked wonders on him. So from then I knew I needed to add this to my practice, and I've helped countless people avoid unnecessary surgery and painful injections and get them better with chiropractic care and spinal decompression. When you look at the anatomy of a vertebrae, we have a vertebrae above and a vertebrae below, and in between we have a jelly type material called a disc. When the disc puts pressure on the nerves, your body's going to let you know. And what's nice about spinal decompression, it's a non-drug, non-surgical method of not only eliminating the pain, but eliminating the problem. So spinal decompression is not only for the lumbar spine, it's also for the cervical spine. So I utilize a DRX 9000, which has a cervical and lumbar unit built into one. And why these discs get injured, especially with people as they get older, is because the discs have a really poor blood supply. So when a disc is damaged, it doesn't get better with time, it generally degenerates and get worse with time. And what spinal decompression does is it helps to revivify or bring the disc almost back to life by returning blood flow to the disc so it can start healing from the inside out. When you think of spinal decompression, what I always like to help patients understand, it's a form of intermittent traction. Traction has been around for thousands of years to help people with ailments, but what spinal decompression did is it takes it and puts it in a controlled environment, and we can unload a specific disc level. And the magic behind spinal decompression and why it works is because it builds up slowly over time, plateaus, and drops down about 25%, and does this rhythmically so the discs can imbibe or breathe in this fluid and heal the disc from within. So it's not a constant or sustained traction, it's a really slow and controlled and intermittent unloading of the spine. So what we're doing by decreasing the pressure in the disc intermittently is allowing the disc to get more blood, more nutrients, and more fluid so it can start healing from within. So a course of treatment for spinal decompression is 20 to 24 visits done out over a period of about 5 weeks. So typically patients will come in 3 to 4 times a week the first couple weeks and 3 times a week until we've done 20 to 24 visits. What we like to do is integrate physical therapy early on the treatment. So the physical therapist will help address bad postural faults and poor movement patterns, and the chiropractor is going to help to address spinal misalignment and nerve irritation. So the combination of the spinal decompression, chiropractic care, and physical therapy, in my opinion, is a pretty complete package to addressing what a patients need when they're suffering with bulging or herniated discs. In the 11 years of utilizing spinal decompression as a modality, I've seen close to 87% success rate. On the odd instances that patients do not get better, we have a very close relationship with a neurosurgeon in the area that does an excellent job in taking patients in, assessing them, and giving them exactly what they need when all other methods have failed. So it is my opinion that all spinal decompression equipment is not the same. There's many different models on the market. I use the DRX 9000, and in my opinion, either the DRX 9000 or the Spine Med are, in my opinion, two of the best tables, and anything under that is substandard. I know for my practice, I utilize the top of the line, whether it's spinal decompression equipment or Cox flexion distraction tables. We utilize top of the line equipment because my patients do expect the best.